The overall incidence of sexual function disorders comprising decreased libido, ejaculation disorder, and erectile dysfunction. What's going on, guys, and welcome back to the channel. Today we're going to be reviewing a clinical research paper titled Finasteride, a review of its use in male pattern hair loss. So this is a relatively short research paper, and one really which reinforces the previous video that I released on the channel. So yeah, I just want to break down with a bit more scientific research showing what finasteride is, and yeah, basically just explain in a bit more detail. So let's just get straight into it. This will be quite a short video today, I think. And the 5-alpha reductase inhibitor finasteride blocks the conversion of test into DHT, as we discussed in the previous video. The androgen responsible male pattern baldness, or androgenic alopecia. Results of phase 3 clinical studies in 1,879 men in 1,879 men have shown that oral finasteride at 1 milligrams per day promotes hair growth and prevents further hair loss in a significant portion of men with male pattern hair loss. Evidence suggests that the improvement in hair count reported after 1 year is maintained during 2 years of treatment. In men with vertex hair loss, global photographs showed improvement in hair growth in 48% of finasteride recipients at 1 year and in 66% at 2 years, compared with 7% of placebo recipients at each time point. Furthermore, hair counts in these men showed 83% of finasteride versus 28% of placebo recipients and no further hair loss compared with baseline after 2 years. The clinical efficacy of oral finasteride has not yet been compared with that of topical minoxidil, the only other drug used clinically in patients with male pattern hair loss. It's important to note that this research paper was actually conducted in 1999, so finasteride had only been FDA approved at that point for 7 years. So we obviously don't have as much information on it back then as we do today. Therapeutic dosages of finasteride are generally well tolerated. In phase 3 studies, 7.7% of patients receiving finasteride 1 milligram per day, compared with 7% of those receiving placebo, reported treatment-related adverse effects. So 7% who were taking placebo pills, which basically means they were not told that what they were taking wasn't actually a 5-AR inhibitor, whereas 7.7% of those that were taking a 5-AR inhibitor reported adverse side effects. So only 0.7 difference. The overall incidence of sexual function disorders comprising decreased libido, ejaculation disorder, and erectile dysfunction was significantly greater in finasteride than placebo recipients, 3.8% versus 2.1%. Say significant, I wouldn't say it's really significant. It's like 1.7% difference. It's very, very small. 3.8% is a tiny percentage on its own. All sexual adverse events were reversed on discontinuation of therapy, and many resolved in patients who continued therapy. So what this is showing is essentially one reported side effect of finasteride is erectile dysfunction, a decreased libido, but what this study is basically saying that 3.8% of the research specimens or the research personnel received adverse side effects in the form of decreased libido or erectile dysfunction. So really, hardly any. And on top of that, all sexual adverse side effects were reversed when they stopped taking finasteride. So as soon as they stopped taking finasteride, the side effects went. Their libido increased, and they no longer suffered from erectile dysfunction. Likewise, those that continued on the therapy, the side effects went away. So that shows that could have been a slight placebo effect. They may have thought that they had erectile dysfunction, because that is a thing. You know, you may start taking a medication, and because you're aware of the side effects, you might almost trick yourself into receiving those side effects. So you might trick yourself into having erectile dysfunction because you're so focused on it, if that makes sense. No other drug-related events were reported with an incidence of 1% in patients receiving finasteride. No other drug-related events were reported with an incidence equal to 1% in patients receiving finasteride. So most events were of mild to moderate severity. Anything that is a reason for a person to not receive particular treatment or procedure because it may be harmful. Oral finasteride is contraindicated in pregnant women because of the risk of hypospadias in male fetuses, which basically means that it's not advised for pregnant women to take, and also if you are trying to conceive, it is not advised for a male to be on finasteride during the point of attempting to conceive. So I would say if you are on finasteride and you're trying to have a child, I'd recommend coming off for that whole period. And that is the end of the study. So as discussed, it is a very short study. It briefly discusses any potential side effects, of which there are a couple, but they are very low risk. And as you can see from this study, only 3.8% of participants suffered from erectile dysfunction, which is arguably the main side effect which you can receive from taking finasteride. And those that received those side effects suffered from those side effects. As soon as they stopped taking the medication, the side effects were reversed. Likewise, those that carried on taking the medication, they got through that period of suffering from that side effect and went back to normal baseline levels. So yeah, I will do another video at some point discussing the side effects in more detail. And to be honest, I am going to start doing more fitness and health related videos, as that is really what I do. For those that don't know, I'm an online body transformation coach. So if you are looking to get in better shape, then feel free to contact me on any of my socials, which I'll tag here. So you've got my Instagram and TikTok are at CAP Fitness, or on the YouTube channel. They are the only three ones that I really use at the minute. So yeah, I will delve into a bit more with regards to fitness studies. For example, my next video, I will be discussing the rep ranges and the effect on muscle growth, i.e. less reps, heavier weight, or lighter weight, more reps. What has the best effect on muscle growth or muscle hypertrophy? So I think that wraps it up for now. Thank you for watching. As always, you can find me on Instagram and TikTok at CAP Fitness. If you found this video useful, then leave a like, comment, and subscribe for the sake of the algorithm. And thanks for watching. See you next time.